Hi, my name is Dr. John Alchemy, founder of RateFast, and today I'm going to talk about Request for Authorization, also known as RFA, and Utilization Review, UR. Anytime in the workers' compensation system in California, whenever a doctor wants to order anything, a medication, a test, therapy, a referral to specialty, the doctor has to create something called an RFA. And an RFA is paired with a report. It's usually a doctor's first report or a PR2 report. It can also be attached to a PR4 or an impairment rating report. But in general, it's with doctor's first and supplemental reports where you're going to find an RFA. So the request for authorization is basically a standardized state form, and on it is where the doctor orders whatever it is that needs to be ordered. It can be a medication, like I said, an x-ray, a specialty consult, whatever. And it has to be signed, and it has to be paired with a particular report. You can't just be in between visits with a patient and create an RFA out of nothing. The patient has to be there for a visit, so it really does need to be attached to a visit somehow. Now, some things on RFAs are what we call pre-authorized, certain medications, things of that nature. However, many things are not. And so for the things that are not automatically approved, let's say an MRI test, it does have to go through utilization review, which is a group of doctors which are licensed within the state, and they review the medical records, the chart, the doctor's reasoning, previous treatment, and decide with guidelines whether or not the treatment is appropriate and indicated. Now, if the utilization review doctor cannot make that determination, then they do something called a peer-to-peer. And a peer-to-peer is basically where the utilization review doctor makes an attempt to call the primary treating doctor or the doctor who's ordering whatever the test it is and have a small discussion about the elements of the case that either weren't clear in the note or weren't clear in the history provided. So for example, sometimes you put in a request for physical therapy. It's unclear if they've had therapy in the past or what the benefits of therapy were, or if the therapy in the past has made them feel better, or what other things they've tried. But basically a peer-to-peer is a doctor-to-doctor discussion about the merits of the request on the RFA. So always think of the request for authorization being paired with the utilization review process, and those two elements kind of go hand in hand. It's an easy way to remember how they fit together, and remember the ultimate purpose is to allow treatment to proceed forward so the case can get to permanent and stationary status.